Hey guys, thank you for joining me for this little bite-sized anatomy class. Today we're just going to be going over the functions and the key risks of the knee joint. So anyone that comes to my classes, you know how scared I am of people injuring their knees. This is from experience of someone who's done damage to their cruciate ligament, the anterior cruciate ligament. I know how long it takes to heal, and still I injured it when I was about 12 and it's still not quite right. So just be super careful when it comes to the knee joint, and I'm going to do a little bit of anatomy to explain why some postures are riskier than others. Spoiler, lotus position is one of the worst, so be really gentle there. Okay, so the knee joint itself is made up of three key bones. So we've got the femur, the tibia, and the patella, which is the kneecap. Around the side here, we also have the fibula, which is attached to the tibia with ligaments. So it's not going anywhere. But what happens is, this is a hinge joint. It's known as a hinge joint, which means it goes backwards and forwards. However, when the knee is flexed to more than 10 degrees, so when the knee is flexed to about 10 degrees, there is also a small amount of rotation that happens at the knee joint, and this is usually where the risks involve in the posture. So think of posture where you bend your knee and then you have the risk of that rotation, lotus, where you pull the knee in. This is a common posture where we do damage. So we've got a couple of parts that we make up the knee joint and what can be injured in these positions. So what we have is, we have the meniscus. So you may have heard of this. If anyone's had a meniscus tear, you know that this is also no joke. So there's like a little cushion padding that sits between the femur and the tibia. And it's got a medial side with a little dip and a lateral side with a little dip. So these are called condyles. The lateral and the medial condyle, they rest in that little cushion. What happens is, it's kind of got a liquid in it, and as you flex and extend the knee joint, this softens and moves around to allow that little bit of lubrication to allow the movement, so it's not bone crushing against bone every time you flex your knee. The movement's very fluid and it's natural and it's meant to happen. The problem happens is when you flex the knee, the posterior part of the meniscus, so the back part of the meniscus, is being compressed by the back part of the femur. So it's getting squished at the back. Then what happens if you introduce rotation, think lotus, so you're rotating the lower part of the leg, the tibia, you are then going to be compressing the medial posterior part of the meniscus. So this back corner of the knee is going to get really, really squished as it flexes and rotates. So it's going to get really, really squished, and then this can cause a rupture or a tear. It comes in different degrees, but overall it's going to really hurt your leg. You're not going to be able to have so much movement. Okay, going over the ligaments now. There's 4 key ligaments in the knee joint that I'm going to cover because they're common ones that you can injure with either yoga or other forms of exercise. So we're going to go over the medial collateral ligament. So that attaches here to the medial femoral condyle and to here, the medial condyle of the tibia. And it also attaches to the meniscus, that little cushiony center, and this stops the lateral movement of the tibia. So if you imagine, it attaches here to here. This is going to stop it from sliding side to side. And we also have the lateral collateral ligament, which attaches laterally to the femoral condyle, and it actually attaches to the fibula bone beneath. It also attaches to the meniscus, and this stops the lateral movement. This is one that's going to get risk of getting injured in lotus as well, because if you move into that internal rotation at the knee joint, you force that movement, this is going to overstretch. It's not going to restore to its natural shape if you tear it as easily, because ligaments, they're not like tendons. They don't have muscle attached to them. They are pretty self-sustaining. There's no blood supply, so they're not really going to heal. This is the problem with ligaments. If you tear a tendon, it hurts, it takes ages to heal, but there is a small blood supply because it's attached to a muscle. Ligaments don't have that, so it takes longer, if ever, to heal a ligament. This is why we want to be so careful, especially if you've become pregnant. We release elastin, which is a hormone to make the ligaments softer, which we need that hormone to stabilize the pelvis and to ready ourselves for pregnancy. But unfortunately, it means that all of the ligaments in your body are super stretchy, and there's a good chance that if you overstretch them, if you become quite flexible in your pregnancy, you're not going to restore them back to their original shape, and you're going to have weaker joints because of it, because they're not going to be there to support you. So be mindful of that, okay? If you're pregnant, you ever get pregnant, you may be super stretchy, super flexible, don't push it, okay? Don't use this new flexibility, be careful, work with strengthening the muscles, okay? Little side note there. Okay, so those are the two collateral ligaments. We now have, moving on to the anterior cruciate ligament, which is one that I injured, okay? It hurt. So this attaches anteriorly to the tibia bone, so the front of the tibia, and it attaches to the lateral femoral condyle. This is one that's really common to injure in Lotus, okay? So also one, probably a better example of the extreme of this is skiing. I've heard this. So when you ski, I've never done skiing, but maybe you've done skiing, you bend the knees. Okay, so that's the trouble here. We're bending the knees. This brings in that rotation. If the knee is bent more than 10 degrees, it's at risk. So there's a bend in the knees, and then to slow down, I think this is right, correct me if I'm wrong, to slow down, you internally rotate at the lower leg. And what that does is, obviously, it stretches this ligament, and if you have a sudden break, this is going to suddenly lengthen that ligament, and it's going to tear that ligament. So be really careful. If you're ever skiing, be really gentle with your knees. Be careful with the braking system. But this is something more extreme, but this is the same principle that we do in lotus position. So be really careful. Make sure you're not rotating at the lower leg. Make sure the movement's coming from the hip joint. Always make sure you fully close the knee joint first, almost like you're locking your heel towards your hip, and then bring the movement into the hip joint, as opposed to just yanking the lower leg up. I'll demonstrate it for you physically in a moment, so you can see what the risks are. Okay, and lastly, we have the posterior cruciate ligament, which you probably guessed is attached to the posterior side of the tibia, and it attaches medially to the femoral condyle, so it's on the back of the leg. This is more at risk if you have a tendency for hyperextension, especially with things like standing forward folds. If you ever look at somebody and you think it looks like their knee is bending backwards almost, they must be super flexible, that's never a good thing. It means that the ligament is stretching. You've probably got quite open hamstrings, and that can be quite a good thing, but you need to make sure that you're keeping a soft bend in the knee if this is your tendency, because what's happening is you're no longer stretching the hamstrings, but you are stretching this ligament, which, as I said, once it's been overstretched, it's really hard to bring back to its original shape. So that can cause tears, it can cause overstretching, and it can cause lack of stability in the knee joint, which you're going to really want when you're older. You know, you really want to keep the joints as safe as possible, the ligaments as strong as possible. Do not overstretch them. Do not risk it for the sake of getting into a lotus pose. It's not worth it. Okay, I'll try and explain that a little bit clearer now with a physical demonstration. So as you can see, my legs are straight, there's no bend in the knees. If I am to rotate my lower leg, that is because the rotation is happening at the hip joint, okay? I can't individually move my lower leg without the movement happening at the thigh joint. If, however, I bend my knee to more than 10 degrees, there becomes this rotation of the lower leg that happens without the addition of the hip rotation, okay? This is fine, it's not unhealthy, it's not unnatural. We evolved this to help us get over rocky terrains and things like that. The problem happens when we use this as a counter for not being most mobile in the hip joints. So postures like lotus, okay? If we're not making up that movement in the hip, often we take it into the ligaments to try and make the movement further. So what we often see is people grabbing their shins like this, their hip doesn't move, and then their lower leg does, okay? So this is where they're kind of twisting, yanking into that position. It's going to cause damage to the ligaments, it's going to cause damage to the meniscus. Maybe some of you have already felt this. If you ever have a pinching sensation in the medial side, the inside of the knee, there's probably a good chance that you're hurting, pinching the meniscus, and you could be on your way to a tear, so make sure you stop doing that. If you are feeling a sensation in the knee and you wanted to experiment with something, I don't recommend you practice Lotus in your everyday until you've opened your hip enough. But something that you can use to test this theory is to come into Lotus. Obviously warm up as much as you can first. Bring the foot to the inner thigh. If you are feeling that pain in the inside of the knee, bring the thumbs, so 2 thumbs, to the space between the calf and the thigh, and then with very gentle external rotation movement, so as if your fingers are spreading away from each other, the thumbs are spreading away from each other. This brings an external rotation to the knee. If this relieves the stress, the pain, then that's an indication that that's exactly what it is. If for any reason you're feeling pain on the outside of the knee, I recommend that this is probably more of something to do with a tight IT band. Maybe you're quite active, and what happens here is that you have a tendency, if you have a tight IT band, it naturally pulls the knee into more of an external movement or a lateral movement, and it can cause pinching on the outside. I recommend that maybe you see a physiotherapist if that's the case, but again, avoid forcing yourself into Lotus. It's still going to cause pain, discomfort, and eventually injury. So I hope that's cleared things up a little bit. If you are working towards Lotus and you're not feeling any pain but you're still not sure, just make sure that when you do, you close the knee joint first. If you do have to grab the calf, say for example you're not comfortable enough to come into Lotus without the foot, just using the musculature, then I recommend that you take it from underneath, okay? So the fingers come towards the front of the shin bone so that you're moving the leg naturally into an external rotation. This is unless you feel pain on the outside of the knee, okay, unless you feel that. If you do, this brings it into an external rotation. It's a little bit safer than that internal rotation, okay? Hopefully it will naturally counter the tendency for that inward rotation. Okay, I hope that's helped. If anybody has any questions, anyone working with injuries, please let me know. As I said, I've had injuries to my own ligaments, so I know how tough the healing process can be. If anyone's looking for any advice in how to open the hips ready for postures like Lotus, then please let me know and I can help along with that. But thank you so much for joining me. I hope you have a wonderful rest of your day. Namaste.